After months of systematic destruction on health facilities across the state, the Ethiopian government has imposed a siege on the region that has depleted almost all medical supplies. The impact on the community has been catastrophic. Children are going without vaccination, pregnant women have limited access to professional care during delivery, and infectious diseases are spreading like wildfire. Head for the Office of Communicable Diseases at Tigray Bureau of Health, Aragawi Garamadhan says, the situation is dire and is putting the lives of thousands in danger, including 7,000 patients of tuberculosis that have not been able to access medication for months.
ጥቅምት 13 እስከ ሰኔ ስናይ
Looking at the data between June and November, almost 80% of patients have discontinued their treatment. Right now, TB patients have absolutely no access to medication, and we are no longer able to test for the bacteria. Not only are the patients suffering, the disease is also spreading rapidly.
But the head says this is just the beginning. If medication is not able to reach those in need, communicable diseases like tuberculosis are likely to spread and cause immeasurable harm.
If the patients stop their medication, we are afraid that the bacteria will develop resistance against the drug and make it even harder to cure. We are really very concerned about the impact this may have on the community in the coming 2 to 3 years.
The head for the office also said that the blockade on food items that has led to a man-made humanitarian catastrophe is also likely to reduce the immunity system of the Tigrayan population in general, not to mention the impacts of a large IDP community in Tigray.
አንድ ሶስተኛው የህዝቡ እንደሚባለው
It is said that 1/3 of people that contract the disease will also likely hold the bacteria in their lungs. When their immunity gets weaker due to lack of food and other reasons, the bacteria is likely to easily develop into disease. In addition to that, IDPs are living in small spaces that don't have any ventilation. If there is even one person infected, he or she can infect 15 others.
The head reminds that international institutions provided medication and medical supplies for TB, malaria, and HIV for free. But since the start of the siege, no medication has reached Tigray. He calls on the international community to take urgent action.
ወደ 17 ወሮች እየሆኑ ነው አሁን
It has been more than 17 months now, and the international community are not responding to the situation. Patients affected by TB are suffering, dying due to lack of medication. The international community should take decisive action, and soon.
A report from the World Health Organization indicates that close to 4 million people in Tigray are going without much needed medical attention.